We are going to discuss Chapter 13 of the Patient Care textbook, which covers venipuncture. At the end of this presentation, students will be able to define intravenous or IV drug administration and related patient precautions, describe the equipment necessary for drug administration, list the standard precautions to be taken during drug administration, describe the best site selection for venipuncture and explain the procedure, discuss the care of patients with an IV line and how to discontinue an IV site, discuss the complications of venipuncture and the radiographer's response, and discuss the process of documentation for drug administration as well as errors. The ASRT has listed venipuncture as part of the scope of practice for medical imaging professionals. They can do parenteral injections through an existing IV line or through a new one. However, federal and state statutes, as well as facility protocols, can supersede the ASRT. So, although it is within our scope of practice to inject patients and start IVs, if the hospital policy or the state or federal says that you cannot, then you follow those guidelines. When getting ready for an IV drug administration, you need to assess the area that you are going to put the IV in. You need to consider the type of contrast, the length of time, and the age and physical condition of the patient before you even begin to determine what needle you will be using and what procedures, etc. Radiographers have several ways to administer medications. One method is through infusion, which can be continuous or intermittent. Continuous infusion, also known as a drip IV, delivers medication slowly over several hours or days. Contrast media can be administered this way over 30 minutes to an hour while taking images at set intervals. If a mild reaction occurs, a sterile IV solution with medication can be used to alleviate symptoms and prevent the reaction from worsening. Intermittent infusion is similar but involves adding medication through a secondary IV, usually to control the amount given, especially to children and elderly. Another method is direct injection or an IV push, where medication is slowly injected over 1 minute into an existing IV line or port. This quickly raises medication levels in the bloodstream, affecting the heart, brain, as well as kidneys. A power injection is another tool commonly used in radiology. It ensures clear imaging of anatomy, including the arteries as well as the veins. This is especially used in CT and MRI imaging. Since the injection is under pressure, not hand injected, it's important to follow proper procedures to avoid complications like extravasation or air embolism. Special care is needed for pediatric cases with slower injection rates and a lower pressure and smaller doses of contrast because their veins are smaller. Intradermal injections are typically injected at the area of the forearm. Intramuscular injections are administered in the dorsal gluteal muscle, the ventrogluteal muscle, as well as the deltoid muscle. And IVs are started mostly in the upper extremities using the cephalic or basilic veins. Intradermal injections, also known as intracutaneous injections, are used primarily to test for sensitivity to contrast media. These injections are given just beneath the skin on the inside of the forearm. It is also used for sensitivity to a drug or antigen, such as TB. When an intradermal injection is given, a small amount of the drug is injected under the dermis, and then the patient is evaluated for any potential reaction. This is typically done at a 5 to 15 degree angle with the needle that is 25 or 27 gauge, which is ½ inch in length. Intramuscular injections can be administered in several muscle areas. The dorsal gluteal, which is located in the upper outer area of the buttock near the anterior superior iliac spine, the ASIS. Ventrogluteal, which is found on the hip by placing the palm on the greater trochanter, and the index finger on the ASIS and forming a V with the other fingers, as shown on this slide image. And the deltoid area, which is what you guys are probably most familiar with, which is the outer part of the shoulder at the mid-deltoid area. This is where they would inject a flu shot. For elderly patients who often have reduced muscle mass, a shorter needle is often used. The safe volume for injecting intramuscular agents is 1 to 5 millimeters, with larger volumes suitable only for patients with sufficient muscle mass. While radiographers in major facilities typically do not administer intramuscular injections due to scope limitations, those in rural areas might be trained to perform this task, as they may have diverse roles within the department. The needle size for an intramuscular injection is typically between 18 and 23 gauge, and the needle length is 1 inch long. Peripheral intravenous routes are the only method by which radiographers may administer contrast media parenterally. The peripheral line is a catheter attached to a needle that goes into the vein, and that this is the only one we can use. A central line goes into the atrium of the heart. Choosing the right vein for venipuncture is crucial and depends on the type of contrast that is being used, the infusion time, and the patient's condition. Veins in the hands and arms are the preferred over those in the lower extremities to reduce the risk of embolism. You want to avoid veins over joints or the palm side of the wrist due to potential needle dislodgement or pain to the patient. Small veins should be avoided to prevent leakage as well as pain. The basilic and the cephalic veins are good options if available. As shown on this diagram, the cephalic vein is on the thumb side of the hand, and the basilic vein is on the medial side where the pinky is, but in the forearm area. Pediatric patients often need extra care as they might be frightened and have trouble staying still. If possible, a parent should hold the child's arm to help keep them calm. Pediatric nurses or specialists should be consulted for vein access in young children using the appropriate size needles. A syringe is composed of a plunger, a barrel, as well as a tip. The syringe has the tip that the needle is attached to. The barrel is the body of the syringe, and the plunger is what fits into the barrel to push the medication or drug through the syringe. The hub attaches to the syringe. That is where the needle is located. The needle has a shaft, and that is the elongated part. The lumen of the needle is the hollow tube within the shaft, and the bevel of the needle is the sharp angulated tip of the needle. All syringes are measured in milliliters and range anywhere from a small size of 1 ml all the way up to 50 ml. All needles, as well as syringes, need to be disposed of properly for safety. Needles can be disposed of into sharps containers that are usually the color red and easily identifiable within the department. Needles often have a safety cover as well, as shown on this image. Once the needle is used, you will put the safety over the top to avoid accidental needle sticks. When prepping for an IV injection, it is important to gather your supplies beforehand so you are prepared. You will need a butterfly needle or an IV catheter, depending on which method is being used in the injection, a tourniquet, antimicrobial wipes, clean gloves, the contrast media drawn up in the correct size syringe, an IV infusion set that includes IV tubing and a drip chamber if needed, clear adhesive dressing or tape for the infusion, an IV pole if necessary, and an infusion pump if it's required. The needles can be of various sizes, and you can use a butterfly or a angiocatheter, which is used to start an IV. Drugs for parenteral administration are packaged to ensure they remain sterile. For IV, subcutaneous, or intradermal injections, as well as IM, they are usually either in an ampule or a vial. Small amounts of medication for IV use can be stored in both containers, while larger volumes are typically kept in a calibrated glass or plastic container for large dosing. An ampule is a glass container holding a single dose of medication. It's labeled with the drug name, dosage per milliliter, and intended route of administration. A vial is a glass or plastic container that has a rubber stopper secured to a metal band. The stopper is protected by a plastic cap to prevent contamination. Some vials are designed for multi-use, but once opened, they must be discarded after 24 hours due to risk of contamination. For larger volumes of fluids, contrast media, or medications ranging from 50 to 1,000 mLs, heavy plastic bags are used. These bags collapse as the fluid is infused, and they have two ports, one for connecting IV tubing and another for adding additional drugs for infusion. This is what a vial will look like. The blue cap is on the vial to keep the rubber stopper sterile. Once the cap is removed, and if it is a single-use vial, you do not need to clean the rubber stopper before inserting the needle to draw up your medication. However, if it is a multi-use vial and the cap has been removed after the initial draw up of medication, in between uses, the cap should be cleaned with an alcohol swab in between uses. This is what an ampule will look like. The medication is stored in a glass ampule, and they are single use. Before drawing up medication from an ampule, you want to make sure that there is no fluid in the top part of the ampule and all the fluid is in the bottom. You will then crack the top of it off and then insert the needle and draw up the medication. One thing to keep in mind is when removing the top, I would use like a gauze pad just to prevent anything from getting contaminated and to prevent potential cutting of yourself when removing the glass top. For diagnostic imaging, the patient must be identified with two pieces of information, as we've discussed previously. The physician needs to decide if using contrast is suitable for the exam. While the guidelines provide general instructions for contrast studies, the physician may adjust their approach based on the patient's condition or available resources. Any deviations from the guidelines should be noted in the patient's medical chart. Before giving contrast, the radiographer should perform the pre-contrast questionnaire to identify any potential complications. The answers will help the radiographer alert the radiologist of any concerns. Sometimes a test dose of contrast is given to the patient to check for reactions before a full study is done. The amount of drug given depends on how it is administered and the patient's age. For children, there are specific dose calculators based on weight, and separate calculators are used for adults. Healthcare workers enter the drug's concentration, the patient's weight, and the intended dose into a calculator to find out the correct amount of drug to give. Contrast media, for example, comes in pre-measured vials for IV injection. Pediatric doses are lower due to children's smaller size and less mature metabolisms. Dose response refers to the relationship between the amount of the drug given and the resulting effect on the patient. Both the amount of the drug and its concentration matter. Generally, very low doses have little effect, and very high doses can be toxic. The goal is to achieve a therapeutic effect that is effective but not too high. A higher dose doesn't always mean a stronger effect and can sometimes reduce risk. Drugs are measured in the metric system, which is standard in most countries, though in the US it's recommended but not mandatory. The metric system uses liters for volume and grams for weight. In healthcare, kilograms and milligrams and micrograms are used. For example, 1 kilogram equals about 2.2 pounds. In the medical setting, both metric and apothecary measurements systems are used, so it's important to understand and convert between them. The metric system is the most common, but knowledge of both systems is necessary for administering drugs accurately. This chart is just a recap of some abbreviations that we've already discussed, and some may be new, so I'm just going to review them. So the abbreviation PO means by mouth. NPO would mean nothing by mouth. IM is for an intramuscular injection. IV stands for intravenous. STAT means, immediately. VO is a verbal order. SC and SQ are abbreviations for subcutaneous. ID is intradermal for an injection. BID is twice a day. GTT is drops. CC is the unit for cubic centimeters. AC, which means before meals. PC is after meals. HS is at bedtime. PRN is as necessary or as needed. Q is every. QD is every day. TID is 3 times a day. Q 2 hours, which is every 2 hours. And ML is milliliters. When administering medications, in particular contrast to patients, patients should be given specific instructions on what to expect and if any type of preparation is needed. To prevent nausea and vomiting after receiving contrast, some facilities ask patients to fast, which means to not eat or drink for 4 hours before the procedure. This would be indicated as NPO for 4 hours. This helps minimize the risk of aspiration if the patient does vomit while they are in a lying down position. However, many practices use non-ionic low osmolar contrast media, which lowers the risk enough that fasting may not be necessary. So in a clinical setting, you guys may see facilities do it either way, NPO for 4 hours or non-NPO for 4 hours. It's just what the facility protocol is. Fasting can also cause issues like fainting or dizziness, so patients should continue to take their prescribed medications even if they do need to fast. Patients should receive written instructions before having a procedure performed with contrast. For those using oral contrast like barium, they should fast as instructed and shake the bottle well before drinking it. Timing is crucial for oral contrast so that the contrast is where it needs to be in the digestive system during the images. Patients should start drinking 1.5 hours before their appointment, consuming 1/3 of the bottle every 15 minutes, and finish the last third at their appointment. Once again, each facility may have their own specific protocol, but this is just generally speaking for barium studies. Diabetic patients need special instructions regarding their medications. Also, provide a contact number for any questions or if they have a need to cancel their appointment. Some patients may also need lab work to check for their kidney function prior to the administration of IV contrast. Blood tests for blood urea nitrogen, BUN, estimated glomerular filtration rate, GFR, and creatinine can affect the choice of contrast used. For instance, if the GFR is below 30 and the patient has chronic kidney disease, gadolinium contrast may be avoided for an MRI due to the risk of potential kidney damage. Standard precautions should be followed when administering drugs, medication, as well as contrast. You want to make sure that you follow the PDART. You want to have the correct patient, drug, route, and time. You want to read the label 3 times and check it. You want to check and inspect the vial to make sure that it's not been tampered with. Make sure the color of the contrast or drug is appropriate and there is no sediment. Does the patient have any allergies and potential for reactions? Anything should be documented. A needle that has to be injected into a person should never be recapped. You want to throw all needles and syringes away in the appropriate sharps containers. And if you as a worker get injured with a dirty needle stick, it is considered to be a hazardous incident and must be reported as a critical incident. So appropriate measures are taken for documenting it as well as for safety for the employee or the worker. When preparing drugs and performing drug administration through an IV, it can be done via bolus or via infusion. A bolus involves giving just a set amount of the drug at one specific time over the course of a minute or two. An infusion involves administering a larger quantity of the drug and fluid or a mixture of both over a longer rate. This can be just a few hours or days. And before starting the vein insertion, the infusion setup must be prepped and ready to connect to the needle that you are using. This image shows just a butterfly needle, which would be used for like a bolus injection. And then it also has a bag of a medication. On the slide, it's just sodium chloride. So this is something that would be administered in a larger quantity over a longer period of time. You want to gather the necessary items, which include contrast, IV infusion kits, gloves, tape, and a needle or an IV, depending on what you're using. If using an existing IV, you want to draw the contrast into a syringe with a clean, unused needle. You want to prepare IV containers, bags, or glass bottles for tubing attachment if you're doing the larger infusion. For a new bottle, you want to remove the metal cap from the top, but keep the band around the rubber stopper intact to maintain sterility of the substances inside. If you are using a bag, you want to remove the blue stopper on the front while keeping the area sterile and avoid touching it. Then you would use a spike to spike the bag that will connect tubing, so the solution in the bag will go from the tubing into the IV that has been placed. Once you open the IV tubing, you want to make sure that it is straightened out and there's no kinks. You want to position a clamp near the drip chamber and close it by rolling the thumb valve to the bottom. So the clamp will already be connected to the tubing. You want to remove the cap from the spike of the drip chamber, ensuring that it remains sterile, and avoid touching it. You want to insert the spike into the rubber stopper of the bottle or the bag, depending on what you are using. If you're using a bottle, do not insert the spike into the smaller vented opening, as this is meant for air to enter the bottle, not for the tubing. So there will be 2 separate ports. Once your bag or bottle has been spiked, you are ready to hang the container on an IV pole. When you're doing this process, you want to squeeze the drip chamber until it is half full, but do not overfill it, as you need to see the drops to ensure that the fluid is flowing correctly. You're going to raise the pole so that the container is 18 to 24 inches above the IV site of the patient. You're going to open the clamp to let the fluid flow through the tubing and remove any air prior to connecting it to the patient. Once the air is expelled, you're going to close the clamp. When performing for a venipuncture procedure, you want to confirm the patient's identity and check for any latex or iodine allergies, and explain the procedure clearly and address any questions the patient may have. Prior to starting venipuncture, you want to perform hand hygiene, whether that is washing with soap and water or using an alcohol-based disinfectant. First, you're going to place the tourniquet on the chosen site, ensuring it is positioned that it can be easily removed by pulling one end. You want to ask the patient to make 2 or 3 tight fists. This will increase blood flow to the area to make the veins more visible. You're going to put on clean gloves. The gloves do not need to be sterile. They can just be regular medical gloves, but ensure that all other equipment used for cleaning or puncturing the skin is sterile. Use an antiseptic or alcohol swab to cleanse the area, and apply firm strokes from the center of the site outward using a new swab each time, and repeat this at least 3 times. So clean the area in a circular motion, and you want to let it dry. You want to hold the skin taut above the elbow of the insertion site and insert the needle or the catheter with the bevel facing up. So the bevel is where the little hole is. And then you're going to insert it into the vein. When you guys are in your second year, you will have this venipuncture class where you guys will actually be able to practice venipuncture. So this is just a review so you have an understanding of what to expect when you see the process. Once the needle is inserted, you will see a blood return. This ensures that you are in the vein. If you do not see blood return, you will need to remove the needle. Or call the IV team for help. If blood returns, you want to release the tourniquet and ask the patient to relax. You will thread the needle slightly further into the vein and connect the syringe with the contrast for a bolus or an infusion. The needle will be removed and then the catheter will remain inserted, and attach the IV tubing and secure the catheter with tape or transparent dressing. Administer the bolus or start the infusion at the designated rate it should be. Document the procedure, including the start time and contrast details, and sign all documentation. Keep the needle in place or the catheter until the procedure is complete to allow for quick response if an adverse reaction does occur. Radiographers should closely monitor patients for any types of reactions, whether using a pressure injector or a hand injection. When patients are receiving contrast, the radiographer should maintain continuous communication with the patient and listen for any changes in their voice as well as their breathing, which may indicate laryngeal swelling. In the event of a severe patient reaction, a code blue must be called immediately. Call the number and announce a code blue and provide the exact location. So what room number you're in, or what department, or what floor. Also specify the age of the patient. The operator will repeat the code announcement 3 times. After the situation is resolved, notify the operator to issue an all clear announcement. An emergency cart, also called a crash cart, is a mobile set of drawers like seen on this slide, as well as trays designed for rapid deployment in emergencies. While contents may vary by location, imaging department carts typically include items for managing cardiac as well as respiratory arrest due to contrast media reactions. Essential items include defibrillator, suction devices, bag valve masks, common medications, along with drugs for intubation, and supplies for venous access. That's why it's always important after you inject the patient to keep an IV line in them. That way you can respond quicker with the necessary medications if you need to, and they already have IV access. It's important for radiographers to be able to identify the medications on a crash cart. Although we cannot dispense medication and give it to the patient, we can assist the physician in charge of the code in gathering the medications from the cart. So on this slide is just a list of medications that are commonly used to treat patients in an emergency. Atropine is used to treat bradycardia. Dopamine is used to treat shock. Epinephrine is used to treat anaphylaxis. Lidocaine is used to treat arrhythmias. Sodium bicarbonate is used to treat acidosis. And vasopressin is used to treat hypotension. In addition to the medications on the crash cart, you want to make sure that you have a transfer board close by if the patient needs to be transferred from the imaging table to a stretcher, also as well as a defibrillator, suction equipment, and intubation supplies if the patient's airway starts to become too closed. Also, it's good to have oxygen on hand because patients who have reactions will typically be given oxygen as well. Some other complications that can arise during the placement of IV and IV infusions would be an infiltration. An infiltration occurs when IV fluid seeps into surrounding tissue instead of going into the vein. This can cause pain for the patients, swelling, as well as compartment syndrome. Symptoms can appear within 8 to 48 hours and include throbbing, tingling, numbness, swelling, and discoloration at the site of the injection. Severe cases may require surgery to relieve pressure and restore blood flow. If untreated, this could lead to limb amputation. An excessive infiltration would be like a very large amount of medication being administered into that area at a specific time. Extravasation is the leaking of fluid into the surrounding tissue, causing tissue damage. It is a medical emergency, especially in pediatric and elderly patients. The symptoms include pain, burning, redness, swelling, and resistance to infusion flow. Immediate actions include stopping the infusion, aspirating remaining fluid from the area, and removing the needle and applying a cold or a warm pack while elevating the area of interest. Phlebitis is an inflammation of the vein caused by irritation from an IV catheter, leading to redness, warmth, tenderness, as well as swelling. This is not serious, but can lead to potential infections. Treatment involves removing the IV, applying a warm compress, and elevating the arm. This will typically resolve in about a few days, but could last up to a week. An air embolism occurs when air bubbles enter the vein, potentially blocking blood flow to the brain, heart, or lungs. Symptoms can range from mild to severe depending on the amount of air that was injected into the vein. Symptoms include difficulty breathing, chest pain, hypotension, or cyanosis. Immediate help is needed for severe cases to prevent respiratory failure or heart attack. It's always important to check your syringes for air bubbles, as well as making sure you run whatever solution you're injecting through the IV tubing, because if you connect your tubing to a bag of medication and don't run it through, you're going to connect the patient to a whole tube of air. So it's very important, and air embolisms are not to be taken lightly. Also, drug incompatibility happens when two drugs combined in a syringe or a bottle and cause a chemical reaction. If this does happen, typically you will see changes in color or consistency of the drug that is to be administered. This is hazardous, so it is crucial to verify drug compatibility before mixing drugs. This is something in radiology you won't have to deal with. Low fluid levels. So if the IV container's fluids falls below the level of the spike, if you're using a bag or a large bottle, you want to ensure that there is enough fluid in the drip chamber to prevent air from entering the tubing. No air should be introduced from an empty container or blood backing up from the insertion site. An infusion should not be stopped without a physician's order, except in the event of an emergency. Patients prefer not to have their IV restarted due to discomfort. The radiographer must ensure that the IV infusion is intended to be discontinued if they need to remove the IV line, and that the catheter is removed at the end of the procedure. To discontinue an IV, prepare dry, sterile 2x2 gauze sponges. Clean disposable gloves, and a roll of tape. You want to undo the tape, have your 2x2 gauze sponges ready, remove the IV while putting the gauze slightly over it, because once you take the IV out, the patient will start to bleed, so you want to be ready to immediately apply pressure. Once the IV is removed, you can place it in the appropriate sharps container, hold the gauze to apply pressure, and then put a piece of tape over it. I always want to ask my patients as well if they take any type of blood thinners. Patients who take blood thinners on a daily basis tend to bleed a little bit more. Their blood doesn't coagulate as quickly, so they may bleed through a gauze pad pretty fast. So you may need to use what is called a cohesive bandage, which is like a wraparound bandage, just to create like a small pressure dressing so they aren't walking down the hallway and then their arm is starting to drip blood. Only a licensed healthcare provider, a physician, a nurse practitioner, or a PA can prescribe and administer drugs. Orders for drugs must be dated, signed, and written by a licensed professional. In diagnostic imaging, the procedure order also serves as the contrast injection order for the study that you are performing. A request for IV contrast media should detail the medical necessity, type of contrast, and procedure specifics. This request must come from the patient's physician. When a radiographer administers contrast, the following must be documented in the patient's medical record: time of administration, contrast name, dose, and route. So where you put the IV, so you say left antecubital. Signature of the radiographer and signature of the supervising physician. If a patient is discharged with a prescription, it must include the patient's name, date, as well as time, medication details, name, dosage, and route, and physician's signature. For stat orders, the physician must provide a written and signed order for immediate action. In the imaging department, if a radiographer assists with medication administration, so if you retrieve the drug from a secure area, verify the drug by checking the label, prepare the drug as needed, or provide the medication and preparation details to the physician, as well as assisting with the administration of the documentation process, this all should be logged as well. The last thing that we're going to discuss is medication errors, how to respond to them, as well as how to document them. All healthcare professionals, including radiographers, are legally and ethically accountable for their actions, especially when administering drugs. Radiographers must be well informed about any drugs they use, as mistakes or misrepresentations can lead to legal liability. The Controlled Substances Act regulates who can administer narcotics and requires these drugs to be stored securely and documented precisely. Medication errors often lead to litigation, and radiographers are frequently involved. If an error or adverse reaction occurs, the radiographer must assess the patient and inform the prescribing physician immediately. You want to document the incident in the patient's chart and complete an incident report according to facility protocol. The incident report should include details such as the patient's name, procedure, error specifics, time of occurrence, notifications made, as well as the patient's condition, and fill out a misadventure or misadministration form if applicable. In conclusion, radiographers must follow the ASRT scope of practice for administration of medications as well as contrast media and must follow state and facility guidelines. Radiographers can be held liable, so they must be competent in administration and documentation as well as reactions and understand the symptoms if a reaction occurs. Methods of parenteral injection for radiographers include drip IV, continuous infusion, or direct injection. Direct injection can be done using a power injector or by hand. Oftentimes, power injectors are used in CT as well as MRI, and they carry a higher risk for extravasation and air embolism. Radiographers can also administer drugs via intradermal injection, which is used to test the contrast in case of an allergic reaction history. Needle angles for injections include intradermal of 5 to 15 degrees, IV 15 to 35, and IM intramuscular at 90 degrees. Needles are composed of a bevel tip and come in different sizes. Syringes are measured in milliliters and vary in size from 1 to 50 or even larger. Both needles and syringes must be disposed of in proper containers that are labeled for sharps. If a needle stick does occur with a dirty needle, it needs to be reported to employee health immediately and an incident report needs to be filed. Medications come in various different containers, which include vials and ampules, as well as medication bags or multi-use vials. Patients must be identified using two identifiers, just like they're doing an exam, prior to the administration of contrast, as well as obtaining an allergy history, and any type of lab work or medications may be needed. Radiographers need to become familiar with the different abbreviations used in the healthcare system, especially like NPO or STAT. Radiographers must be competent in the performance of venipuncture. In the event of an emergency, the radiographer must know how to call code blue or whatever the hospital code is to ensure that the code team can arrive to the location. Also, you should know where the crash cart is within the department and know what medications are on it and where they are located in the event that you need to assist a physician during a code blue. Complications of venipuncture can arise and often happen very quickly. Extravasation and infiltration are very common. The difference is that in infiltration, there is no damage to the tissue, whereas with an extravasation, the tissue is damaged, so it's a little bit more risky. Other complications include an air embolus, phlebitis, or drug incompatibility, and the fluid level falling below the level of a spike when using a bag or a bottle to administer the contrast. Discontinuation of an IV must be ordered by the physician, and you need to ensure the appropriate steps in removing the IV. Documentation of administration must be done correctly, and you must include the patient's name, date, time, amount, route, as well as any reactions. The radiographer and the physician must sign the document. All documents must be filed in the patient's medical record.